We're now live. We're now live. Wonderful.
It's live, so you can't
Wonderful, wonderful. Okay, so we're here to talk about Gainswave, which is an amazing technology that we have here in the practice. Dr. Mata, would you like to let me know what Gainswave is?
Well, Gainswave is more of a protocol, and you're like, what the heck's a protocol? Well, basically, it's a method of being able to enhance the penis area down there for men and also for women to increase blood supply. And you're like, well, what is actually Gainswave? It's actually a method of using what's called shockwave therapy, where through short spurts of vibrations that cause the cells in your area down there to basically increase the synthesis of things like VEGF, and you're like, what the heck does that mean? It just basically means that it increases blood flow, blood supply.
But it's important, it doesn't hurt.
Correct.
This is not painful, there's no downtime, so it's really important for our patients to understand there's a lot of discreetness to this treatment because it's not like you're having a lot of downtime, you have to explain it to anybody. We kind of want to take the taboo off of this topic because there is a lot of help out there for our patients, and so we kind of want to open up the conversation about this.
And I think it's important from the standpoint that at some point in every man's life, they will probably go through some erectile dysfunction or basically ED. And basically that's probably 60 to 80% of the time has to do with blood flow issues. Some of the times it's up here, it's psychological, but anytime you have an issue down here, because the anatomy is not working or basically the plumbing's not right, that affects up here. So then all of a sudden it's a cycle that repeats itself.
And this can happen for young men, old men. We have men of all different ages coming in for this treatment, so it's definitely not a discriminator of your age by any means.
Correct. It's just knowing that eventually over a period of time you're probably going to have some issues with that. Literally, a lot of clients that use this sometimes are in the industry where they don't have issues, but it can help men go longer sometimes, and it can help increase the length, sometimes even the girth. Because if you imagine the plumbing, and the wider the plumbing becomes, the more blood flow comes in that area. So you're maximizing everything that God gave you. Right. It's not like we're actually augmenting it, but if you're using all the real estate you have down there, it's going to seem bigger, and most people don't complain about that aspect.
Right. So definitely an enhancement as well. Even if someone is functioning perfectly well, they can even enhance their love life by, doing a procedure like this for sure.
And here's the thing about it. It's not like you come in for one treatment and that's it, you're done. Basically, it's a series of treatments. Usually we recommend anywhere from 6 to 12 treatments. Anywhere from 2 the first week to 1 a week for 6 weeks. Sometimes, depending on what patients want, I advocate using a P-shot to help augment the results, to increase sensation, the vascularity, and just a better experience for the man. And usually, because if you're increasing the size in terms of girth and a little bit of the length, obviously most women will not complain about that from that standpoint.
Or the man, it helps his pleasure sensation as well. So
yes, anytime you have more vascularity and the nerves, because again, the biggest problem with ED is the lack of blood flow. So as the lack of blood flow, that starts to affect the nerves, and so as it affects the nerves, that means decreased sensation. That's where a combination of the Gainswave along with like a P-shot will maximize the ability to be able to have as much vascularity down there and bring blood flow to the nerves, so it increases sensation. And also some people sometimes have issues with premature ejaculation, so they can't ever get to the point of going longer. Sometimes this helps with that because the vibrations will have the nerves in ways that other things cannot. So it's not necessarily a bad thing to do it for that standpoint as well.
And the reality is we understand if someone is struggling with ED, they've probably looked at everything under the sun at this point. They've done prescription medication, they've spent a fortune on that, they've spent a fortune on other items to try to help with this, maybe even visiting a urologist. So a lot of times we like to have a conversation with the patient and educate them on what this is going to do, but the cost of this is almost nothing compared to a lot of other therapies out there that people have tried that don't work. So this definitely works, and it's definitely worth looking into.
Yeah, and I think from the standpoint of talking about pills, for example, or basically Viagra or Cialis, usually those are about $10 a pill on average. That's the cost of it. And depending on how often you're choosing to have intercourse, that determines your cost. When it comes to the Gainswave from that standpoint, 6 treatments is usually about $3,000. So it might seem like a lot, but from the standpoint, if you get the longevity of not having to be like, gosh, I have to plan 30 minutes ahead to make sure I take the pill so that I'm ready to go 30 minutes later. This, once it starts to kick in, you're ready to go whenever you're ready to go. Some people do this before they're having a very extensive long weekend, so we call them weekend warriors, but they come and have a treatment before the weekend, because there's some patients that have the treatment and literally within 4 hours will have a spontaneous erection. On their own, no pills, no nothing, just because whenever you do the treatment, you release what's called nitric oxide, which is a vasodilator that basically makes the blood vessels get bigger. And so the only thing that I kind of recommend for patients is after you have a treatment, you try to make sure that you at least have one erection within 24 hours.
Homework.
Yes, homework for sure. From that standpoint, I always pose it out if anybody's watching, if they have any particular questions or concerns that we can answer them while we're doing this live segment. We're all ears. Any other questions that you guys can think about?
One of the biggest ones was the price range and cost. And so I think along with that, a question would be, how long does this last?
Well, I think from the standpoint of lasting, it just depends on every patient. Obviously, if your plumbing is really bad, and let's say you can't even get an erection with pills, for example, you might need 12 treatments to get you to a point where maybe now you have a semi-rigid erection as opposed to full blown. But it's not a miracle, but there's no patients that don't see benefits. All patients will see some benefit. It's just what do you consider some benefit. Some people go from, hey, I need a pill every time I do this, to maybe I only need a pill every 3 times I have sex. Other people use a pill here and there, and they're like, God, I've never had to use a pill for 2 or 3 years now. Some people do this, and because the plumbing's so bad, they need to come back and get a treatment once a month. It's so variable because the degree of issues when you're talking about erectile dysfunction is a full spectrum, to people that have none, to people that basically can't have an erection, period. And so it's kind of hard to say, but again, most patients do see improvements. The last gentleman that I treated basically couldn't get an erection at all, like 0. He took pills and it was very little. And by the time we finished our 6th treatment, he was able to think about an experience or something, and that would cause movement down there, which before he had 0.
That's awesome.
So that's showing that it's functioning, but sometimes it just requires more treatments. And we also do have a plan where you can sign up and basically come in once a month and get treatments. So that's the variety of spectrum that we have for Gainswave, all right?
Wonderful. And then I think another question was here, what's the pain like?
There's 0 pain, like no pain at all when you have the treatment. From that standpoint, it's really hard to kind of show you, because most men, when they have ED, don't want to come in and have me film this to be able to show you guys. So it's kind of a very private issue.
It is, yeah.
That most men, when they're self-conscious about that, to get to the point in my office when we do a treatment, don't want to be filmed. They don't want anybody knowing about this. This is on the hush-hush, DL, whatever you want to call it. They don't want anybody to know. So that's the hard part about actually showing you the procedure, but we can maybe do a demo later this week and just show you what it's like on an arm, to kind of show you how it works from that standpoint. But there is no pain. And even if you have any kind of issues down there, we can always put numbing cream, and that makes it even more numb from that standpoint in terms of absolutely 0 discomfort. Okay?
For sure. And then this would be a great gift for ladies as well, to call in for their significant others.
Absolutely. I mean, I can definitely speak for women on that point. I think a lot of times when you see a male seeking help for this, a lot of times he has a woman behind him kind of nudging him along the way. You know, this really is, it's a team effort, you know, in a couple. It's affecting both of you, not just one. We really try to encourage, you know, men, this isn't a you problem, this is an us problem, so to speak. We're here to help and be very discreet, answer questions, make sure that, you know, we want to help in this area, not just, again, for the male, but also for his counterpart. And a lot of times those are the people who are seeking the help.
Yep, I agree. And the last thing that I'll mention on this before we end our little live segment is that they're doing preliminary studies right now by Gainswave to see the efficacy or how effective this is for women. Because sometimes women also have what's called dyspareunia or painful intercourse, either because of lack of lubrication or lack of sensation, or anorgasmia, where basically a woman has never had an orgasm. And it has nothing to do so much with the guy. It's just sometimes the anatomy is not quite right. So sometimes you can do this to increase the vascularity down there in conjunction with a nose shot to help women get to a certain point. Sometimes when you do this in conjunction, literally some women have had an orgasm from doing the procedure and all of a sudden increasing that blood flow to that area. So it is pretty dramatic. Okay?
For sure. And I think that's all the questions we have. So let us know so that we can kind of film like a little demo later on this week if that would be something you guys would be interested in. And you guys can always give us a call, 480-418-5300. Thank you guys.
Bye.